What if working harder at your knee replacement recovery actually made your knee stiffer? I know that sounds backwards. You'd think that more exercise, more walking, more effort would equal better results. But for a surprising number of patients, pushing too hard too soon leads to the exact opposite outcome they're working toward. This is one of the most common and counterintuitive traps in knee replacement recovery, and it catches motivated, hardworking patients more than anyone else. In this video, I'll explain exactly why doing too much can backfire, how to recognize if you've fallen into the trap, and most importantly, what you can do about it. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained, board-certified orthopedic surgeon who specializes in hip and knee replacements. I've seen this pattern set back countless recoveries. Let's make sure it doesn't set back yours. So why would more effort lead to worse outcomes? To understand this trap, you need to understand exactly what's going on inside your knee when you overdo it. Here's the key concept. Recovery follows a bell-shaped curve. On the y-axis, we have speed of recovery. On the x-axis, we have stress on the knee. On one end, doing too little leads to stiffness. Your knee needs movement to heal properly. But on the other end, doing too much triggers an inflammatory cascade that can be just as damaging, sometimes even more so. The ideal range of stress on the knee with exercise and activity is somewhere in the middle. Think of it like watering a plant. Too little water and it wilts. Too much water and the roots rot. There's a sweet spot in the middle. And finding that sweet spot is what separates patients who thrive from those who struggle. Now, here's where it gets interesting and problematic. When you push your knee beyond what it can handle, you trigger excessive inflammation and swelling. This is a problem for at least 3 different reasons. First, that swelling shuts down your quadriceps muscle, the large muscle on the front of your thigh. This phenomenon is called arthrogenic muscle inhibition. Basically, what this means is that even a small amount of extra fluid in the knee can significantly reduce the muscle's ability to contract. Studies show that even just 20 to 30 milliliters of fluid, or 1 to 2 tablespoons, can trigger noticeable quad weakness. Why does this matter? Because your quadriceps is essential for straightening and stabilizing your knee. When it shuts down, you can't achieve the range of motion you're working so hard to get. Your knee gets stiffer, not more flexible, but it gets worse. The second problem that overdoing activity creates is a vicious cycle. Inflammation from too much activity or exercise leads to swelling. Swelling makes the knee stiffer and harder to bend. That often leads to patients pushing even harder, starting the cycle all over again. Third, inflammation is a key component in arthrofibrosis. Arthrofibrosis is a condition where thick, fibrous scar tissue forms in the joint, limiting its movement. And the key drivers of arthrofibrosis are the microscopic inflammatory molecules that flood the joint during inflammation. Arthrofibrosis can lead to chronic stiffness that may require additional procedures like manipulation under anesthesia or even surgery. So what does this mean practically? Here's the bottom line. A quiet, dry knee bends and strengthens. A hot, swollen knee stiffens and weakens. Understanding that distinction is half the battle. But how do you know if you've crossed the line? Here's what might surprise you. The warning signs aren't always obvious, and they don't always happen immediately. The first sign is your swelling pattern. Some swelling after knee replacement is completely normal, and it can take months to fully resolve. But here's the key. It should trend downward with time. If that swelling is getting worse, especially if that flare-up lasts more than 1 day, that's a signal that you may be exceeding what your knee can currently handle. The second warning sign is when your range of motion stops improving, or even worse, actually decreases. If you had 110 degrees of flexion yesterday, but after strenuous therapy you can only get to 90 degrees this morning, you may have overdone it. It's common to have soreness after therapy, but loss of mobility may be a sign of pushing too hard. Next is a sign that catches many patients off guard, and that is worsening pain. The early recovery after knee replacement is painful for most people, but a well-paced recovery usually means manageable pain that improves with time. If you wake up in the morning after an active day with significantly more pain and swelling than usual, you may have overloaded the joint. Overworked knees often become more painful later in the day and overnight, as the inflammation and fluid accumulate. Lastly, pay attention to excessive warmth in your knee. It's normal for a healing knee to be a bit warm even for months after surgery due to increased blood flow. But if your knee is radiating more heat than usual, that may be a sign of increased inflammation. Before we move on, I need you to understand 2 things about these signs. First, day-to-day fluctuations in these symptoms are often completely normal, and even expected to some degree. But if you notice symptoms trending in the wrong direction for several days, That's a sign to pay attention to. Second, and above all else, if you have concerns about your recovery, don't rely on YouTube to figure it out. Talk to your surgical team for further guidance. Now, here's where things get complicated. I can't just give you a magic number to follow. If I could tell you do exactly this many reps, this many steps, this much intensity, I would. But the truth is, what is too aggressive for one patient is not enough for another. People differ enormously in their response to exercise and their capacity to heal. Factors like your fitness level, your age, or even your psychological approach to recovery all influence how much activity your specific knee can handle. Someone who had very limited motion before surgery may need a more cautious approach. An athletic person in their 50s might tolerate more intensity than another person in their 80s. Studies show that high-intensity rehab is safe and effective, and it might facilitate faster recovery in some patients. But studies also emphasize that these programs must be carefully designed and appropriately supervised. The same intensity that produces excellent results in one patient can trigger the inflammation cycle in another. This is why no one can give you a one-size-fits-all approach. What I can do is show you how to read your own knee's signals, and that's exactly what we just covered. Your knee will tell you when you've done too much. The question is, what do you do when it does? Let's talk about how to get out of this trap and how to stay out going forward. Check with your surgical team first, but these are commonly used and generally very effective strategies that get patients back on track. First, scale activity back and allow recovery. This doesn't mean complete bed rest. This means a temporary reduction in activity until the flare-up calms down. This works by breaking the inflammation cycle and allowing your tissues time to settle. Less inflammation means less pain, more quadriceps strength, and better motion. Elevating your leg above your heart also helps reduce swelling and inflammation by helping fluid move from your leg back to the rest of your body. Patients often notice improvement after a day or two of recovery, and from there they can gradually increase activity again. Second, work with your physical therapist to temporarily modify your exercise routine. It's usually best to avoid high intensity if your knee is extra inflamed. For example, if you were doing 2 sets of 15 squats, cut back to maybe 1 set of 10. Or switch to a lower intensity exercise like the stationary bike. The key is to first bring inflammation and swelling down, then resume strengthening. These first 2 strategies address the root cause. These next 2 accelerate your recovery. Third, prioritize ice and compression. Cold therapy can be applied to the knee about 15 to 20 minutes at a time. Be sure to use a protective barrier like a pillowcase between the ice pack and your knee, and take at least 30 to 60-minute breaks between icing. A compression stocking or wrap also reduces swelling by pushing fluid out of your leg. Fourth, be sure to take medications like your surgeon prescribed them. Many patients are prescribed anti-inflammatory medications after surgery. Taking these regularly can help you recover from a flare-up. Some patients have to avoid anti-inflammatories because of medical problems like kidney or gastrointestinal disease. So just know they're not for everyone. Now let's talk prevention, how to find that sweet spot and stay there. First, adopt the right philosophy. No pain, no gain is probably not the best approach here. I think a better philosophy is some pain, some gain. Exercises should challenge your knee in a low to moderate pain range, with pain and swelling ideally improved by the next day. If significant pain or swelling occurs, temporarily backing off can actually lead to better long-term gains by preventing setbacks. Second, use the 24-hour rule. After new activity or exercise, assess your knee 24 hours later. If pain and swelling are back to your baseline, that activity was probably okay. If things are much worse, you probably did too much and should scale back. Keeping this simple feedback loop in mind lets you tailor activity to your personal tolerance and takes the guesswork out of the process. Those 2 strategies help you calibrate. The next 2 help you sustain it. Third, work with your physical therapist to build recovery days into your routine. If Monday, Wednesday, and Friday are your PT days where you work extra hard, Tuesday, Thursday, and the weekend might be lighter intensity days. Even elite athletes use recovery days to prevent overuse injuries, and the same concept applies to recovering from surgery. And finally, track activity if you can. If you have a smartwatch or pedometer, use it. Step count data helps you identify patterns. If 5,000 steps cause too much pain and inflammation, you might try staying under 4,000 for a week and then reassessing. As recovery progresses, your ability to tolerate more exercise and activity improves, and you can try gradually increasing again. So here's the bottom line. More isn't always better after knee replacement. Your goal is to find that sweet spot. Enough activity to progress, but not so much that you trigger the inflammation cycle that leads to stiffness. If you recognized yourself in what I described today, know that you're not alone. This trap catches motivated, hardworking patients all the time, the same people who are trying their hardest to do everything right. The good news is that once you understand what's happening and adjust your approach, you can break the cycle and get back on track. Recovery from knee replacement isn't a straight line, and it definitely isn't a sprint. It's about consistent, smart effort over time. Follow your surgical team's guidance, listen to your knee, and trust that doing it right will get you further than doing it fast. If you'd like to know my top 8 exercises in the first 6 weeks after knee replacement, that video is right here. And if you'd like to learn about 9 causes of knee replacement stiffness that often catch patients off guard, that video is right here. If you found this helpful, please click the like button. It helps others find this video when they need it most. Stay well, and I'll see you in the next video.